Greenlight HPS 120 watt laser fiber degradation and failure. Surgery and narration by Dr. Kevin Zorn. One of the major issues with the first and second generation laser fiber is the fragile nature of the quartz cap. It is for this reason that extreme care must be made to protect the integrity of that fiber and prevent devitrification and potential failure. Techniques that have been described include avoiding any tissue contact, working at an optimal space of 1 to 3 millimeters from the tissue, and taking the time to remove any tissue that's attached to the laser cap. For those surgeons who do not have access to the third generation XPS 180 watt fiber system, which has a metal cap protective system with irrigation, otherwise known as the Moxie fiber, the following video will highlight some aspects that should be avoided during surgery. Here we begin at the beginning of a surgery on a gentleman with a 120 gram prostate with kissing lobes. Here we can see the initial pristine nature of the glass quartz cap fiber, which upon rotation and at best trying to avoid tissue, there are some aspects upon initial treatment with sweeping that the glass will come in contact with the tissue and therefore stick. I usually recommend to those using the HPS Mojo fiber to try to use the back edge of the cap to push in the contralateral lobe, therefore giving at least a working space between the exit site glass and the tissue. As such, if some tissue were to stick, it would be most likely along the backside and away from the energy delivery site glass of the fiber. Nevertheless, it is still impossible to keep this pristine in certain anatomic configurations of the prostate. I would usually recommend the surgeon to remove the fiber and wash off the cap either with a saline impregnated gauze or with an alcohol swab. Here we can see on the second pass of this intermediate surgeon the fact that already the fiber has shown some sign of degradation. This darkening of the glass, kind of like looking through a dark window, minimizes the energy delivered to the tissue and therefore hampers treatment. It also allows the glass to potentially overheat and fracture. We will now demonstrate a segment of the surgery where the glass fractures. This occurs extremely rapidly, as can be seen in close contact. There's an initial flash of white and followed by a lack of the aiming beam. We will replay now in slow motion to show the very distinguishable flash that is seen during the fracture. At this point, the surgeon is forced to retrieve another fiber, which could increase the cost of the procedure by $600 to $800. Thank you for your attention, and I hope this video helps in your technique.